morning, my name's Claire Bamber. I'm Professor of Public Health at Newcastle University, and I'm the co-lead of the Health Inequalities theme of the School of Public Health Research. I'm delighted to be able to provide an overview of the work that we've been doing over the last year. So the aim of our theme is to ensure that SPHR undertakes research that supports local actions to address health inequalities. And we have various objectives through which to achieve this aim. We want to embed an intersectional approach to health inequalities across the school, to undertake collaborative research with the other programmes and themes in the school, to provide networking and engagement opportunities and knowledge exchange within SPHR and beyond, and to undertake some small cross-cutting projects within our theme. I'm going to talk a little bit about what we've been doing in regards to each of these objectives. Firstly, in terms of embedding a health inequalities approach across the school, then we have a specific project called Strengthening the Intersectional Equity Focus in Public Health Research, which is led by Lilac and is a joint project with ARC Northwest Coast. Within this, the team have been revising the health inequalities assessment tool in order to embed an intersectional perspective in terms of how we understand research on health inequalities. The team have completed a systematic review and held a series of workshops across the SPHR and across the NHR ARCs. And the tool is being revised and will be launched later in the year. In terms of collaborative research, the members of our theme have been working closely within the programmes, as you will see later today, and within the updates delivered there. In terms of networking and engagement, this is a prime focus of the theme as we host the Equal England Research Knowledge Exchange Network. And we've been holding a number of bi-monthly online collaborative events during the pandemic. Each of these has had around 200 participants, and to date we've done sessions on COVID-19 and inequalities, COVID-19 impacts on the Northern Powerhouse. We did a joint one with the Places and Communities programme, and we also have one on child poverty and the implications for health inequalities. We've also partnered with the ESRC Leeds Partnership for Social Justice and co-hosted 4 events with them on the wider questions of the social determinants. We have a joint seminar with the School of Primary Care Research on improving diversity in research, building on our success in developing a public panel of 55 members who are supporting our health inequalities research development. The network membership of Equal England is now around 900, a large increase over the last couple of years, and this is made up of researchers, practitioners and policymakers across the country. In terms of cross-cutting research, we've been leading 2 pieces of work from LSHTM in Sheffield and from Imperial, looking at 2 different aspects of health inequalities using different methodological approaches. In work package 2, Health at the Intersections, we've been holding online focus groups during the pandemic to examine the different experiences and understandings of health inequalities amongst young people using an intersectional lens. We've completed 4 workshops with ethnically diverse young people, some in London, in the south of England, women from Sheffield, and young men in disadvantaged communities in the northeast. The findings here will be explored further in our workshop later today. A new piece of work that just started this year is around reducing local health inequalities through action on the social determinants of health. This is a large evidence review led by a team at Imperial in partnership with other members of the school. The researcher has been appointed and has now started doing some scoping searches, and the focus is likely to be on intersections between socioeconomic status and ethnicity and finding interventions which have been effective in targeting these joint areas of disadvantage. Like many over the last year, theme members have spent a lot of time focusing on the emergent issue of COVID-19 and health inequalities. For example, in the Northeast, Fuse has been heavily involved in health inequalities impact assessment, joint with our regional PHE team. We've also published the independent SAGE report on inequalities in COVID-19 last November, and various members of the theme were involved in the Northern Health Science Alliance report on COVID in the Northern Powerhouse. Fuse and Cambridge published a joint article on the syndemic pandemic of COVID-19, outlining the causal pathways through which the COVID-19 is exacerbated by existing inequalities and leading to further health inequalities. We've had a number of outputs over the last year, which I've listed here in case you're interested in reading more. And I look forward to seeing you later in the day as part of our workshop on health at the intersections. Thank you very much for listening, and I hope you enjoy the rest of the ASM today.
Hello, I'm presenting on the efficient and equitable public health systems cross-cutting theme. My name is Dr. Penny Breeze from the University of Sheffield, and I'm co-lead with Professor Alan Brennan and Dr. Rachel Hunter from UCL. The project aims were to inform how evidence on financial and economic impact and equity is best reported. We want to improve the quality of SPHR outputs on efficiency, equity and systems methods, and produce evidence on the wide economic and wider social impacts of programmes from the core themes. So in Work Package 1, we're developing guidance documents to support the reporting of efficiency and equity outcomes and systems modelling methods. In Work Packages 2 to 4, we're closely linked with the core SPHR themes to extend these programmes and produce quality evidence on the efficiency and equity implications of public health interventions. In Work Package 1, we aim to develop reporting guidelines for efficiency, equity and systems models. For each of these themes, we are running workshops with academic experts, public health practitioners and also public involvement to develop best practice guides on these methods. And we'll be producing guidance documents and organising a workshop to disseminate the findings from these this project. In Work Package 2, we're evaluating the efficiency and equity impact of food policies to improve public population health. We're closely linked with the Places and Communities theme and have been engaged with researchers from LSHTM to extend the work they're doing on junk food advertising for Transport for London. So currently we're involved in stakeholder engagement to develop scenarios for local initiatives on junk food advertising restrictions. We want to combine some new research to develop a framework to translate changes in food purchasing into long-term health and economic outcomes. And we're utilising an existing microsimulation developed with SPHR in the past for diabetes and obesity prevention interventions. We're extending that model to evaluate the impact of food advertising restrictions. In Work Package 3, they're looking at the social and economic benefits of improving equity and access to public mental health interventions. So they've been working with public mental health researchers from the SPHR theme, and they identified co-located welfare services that were provided by citizens' advice at GP services. There is evidence from these initiatives that there is improved financial and employment benefits of these programmes, but there are no cost effectiveness analyses of these policies. So the aim of this research is to look at the long-term outcomes of improved mental health using data from IAPT and Understanding Society by looking at changes over time by matched areas with and without the co-located services. And the research has been really well supported by McPin, who've been providing expert theory and experience input. In Work Package 4, we're evaluating the impact of childhood public mental health interventions on long-term health and wider societal outcomes. The research is split across Lilac and Sheffield. Currently, collaboration with researchers from Bristol and Lilac identified that bullying interventions for LGBTQ in adolescence are a priority for efficiency and equity evaluation. So we're looking to translate these interventions into long-term societal benefits. The methods used are split between those two institutions. So in Lilac, they're looking at using econometric analyses of linked data, And in Sheffield, we'll be using microsimulation methods and the life sim model developed at the University of York. I just wanted to say thank you to all the researchers who are contributing to the efficient and equitable public health systems theme, and thank you for listening.
This 5-minute slide presentation will give an overview of the changing behaviour at population level cross-cutting theme. This theme is led by myself, Lydie Goyder, based in Sheffield, and my colleague Martin White, based in Cambridge. It was previously led by Falco and Mika, based at Fuse, and the programme has been developed with input from all the school university partner organisations, as well as from our stakeholders and many colleagues in the public health policy and practice world. We have 2 projects led by Mika, based at Fuse, and Steve, based at the London School of Hygiene, and I will say a bit more about both those 2 projects. But first, just to summarise our overall aim as a cross-cutting theme. Overall, our aim is to support the school to do research that will address local actions to apply evidence-based principles to influence population behaviour change. We also have a focus on principles that enable us to understand how we can minimise the social inequalities through behaviour change. Given a history of behaviour change policies that have sometimes exacerbated rather than mitigating inequalities, and the current worsening of many of the drivers of inequality, this is really crucial to the theme. The theme initially identified 3 grand challenges for behavioural science which we aim to contribute to develop a truly integrated transdisciplinary science of population behaviour, and secondly, to develop the tools to predict how effective interventions can be in changing population behaviour, and as I say, also the impact on inequalities. The third grand challenge is the one that relates most closely to our first project, Project 1. So Project 1 is about understanding and negotiating public support for policies designed to change behaviour. It's absolutely crucial if such policies are to be acceptable as well as effective. We're doing this with a focus on dietary and active travel related policies, and in close collaboration with the Places and Communities programme that is looking at interventions in these fields. But the overarching aim of this particular project is to develop a framework model that can actually predict the public acceptability and support for different policy options. So we're identifying particular policy options which are relevant and of interest to our stakeholders, and looking at what features of these policies may influence support and how support may vary between different demographic groups. We will then use the findings to develop a framework that policymakers can actually practically use to explore this. Our second project is looking at the impact of digital delivery services on food purchases and inequalities in diet. This is really important because we already know that this is an important social trend. We already know there is a social gradient in the use of these takeaway delivery services, and we know that the services are more likely to be used in disadvantaged areas, and that their use is associated with more obesity and higher body mass index. So this project will explore these patterns in more detail. Crucially, it will be able to link data from the Places and Communities theme with other data from the Cantor Consumer Goods panel and from data on residential exposure to food outlets. So if you want more information about the theme, there's a workshop and there's more information on the school's website, and I have put on the slide the contact details for both the theme leads and the project leads. Thank you very much for your attention.
Hello, My name is Jenny Popey. I'm based at Lancaster University and I'm a member of the Liverpool and Lancaster Collaboration for Public Health Research, which is a member of the NIHR School of Public Health Research. I'm also the coordinator for public involvement and engagement in SPHR. And I want to tell you a bit about our strategy for public involvement and engagement and highlight just some of the milestones in our implementation of that strategy. I'm going to be talking mostly about public involvement rather than engagement, by which we mean the research with members of the public as partners, not research on members of the public. So the strategy sets out our vision for public involvement, which is that the school becomes an organisation that does inclusive public involvement in all of our work, and that it ensures that the members of the public that get involved in our work have a real impact, a real influence on our decision making at all levels in all ways. We have done that. Our commitment to public involvement is because we believe by doing that we will be more accountable for the public funds that we have to spend on our research. But equally importantly, because by involving the public as partners, by working equally with the public in all of our work, we will ensure that our research is of most relevance, is most timely. It will increase the uptake of our research by public health practitioners and local policymakers, by community activists and other people involved in public health, delivering public health. And by increasing the uptake, it will increase its impact on the health of the people. So we have three high-level strategic objectives that we want to achieve in implementing our strategy. The first is focused on ensuring that we are an organisation that will establish, sustain and value collaborative, respectful relationships between the members of the public who we work with and the academics who are employed and work in the school. Our second objective is to ensure that we produce high quality opportunities for the public to get involved that have real impact on our research. And we want to ensure that the people who get involved, the public who get involved, reflect the diversity of the population of England, and England is our remit. But we have a particular interest in getting members of groups who are bearing the brunt of social and health inequalities involved in our research. That is, groups whose voices are less often heard in the research arena. And our final objective is to ensure that we learn from our experience of public involvement and the experience of our public partners, not just about the process of involvement, what works well in terms of involving people, but also about what impact that has right across the research process, from setting our priorities, developing our questions, etc., and mobilizing the knowledge at the end. And critically important, that objective is about making sure that we use the learning to improve the quality of involvement for everybody in the school, and that we make it publicly available. So we have a triangular architecture structure to deliver on these objectives. So one corner we have a strategy group, a strategy implementation group, and on that group we have senior academics from each of the 8 members of the school, and they're responsible for overseeing the delivery of the strategy. In another corner of that triangle, we have an operational group, which is a very diverse membership, again from right across the school. It's got early career researchers, mid-career researchers, postdoctoral research fellows, doctoral fellows, and they're delivering many aspects of the actual strategy. And then the third corner of this triangle, absolutely vital, is our public partners network. We affectionately refer to it as the PAN. And that has three key functions, really. One, it's a space for members of the public who get involved in the school to share their experiences and learn from one another. It's an opportunity where people can gain new skills and new knowledge. So it's a training space as well, and development space. And it's also a space where public partners get opportunities to be involved at a strategic level in the school. So all of our public partners, every member of the public in the school is automatically a member of the PAN. And they, of course, are involved in governance at project level and program level. But what the PAN does is open up opportunities for them to get involved in activities that cross the school, that cross the members of the school. So let me tell you then some of the highlights, some of the things that we're delivering on. And I'll start with the PAN. Although the PAN and the operational group and the strategy group are working collaboratively on all of this, and of course with other members of the school. So the PAN has set up 3 subgroups. The first subgroup was a communications subgroup, and they've been working with our communications officer. They started by working to improve the quality and accessibility of the website, particularly the pages around public involvement. And they're now moving on to get involved in other aspects of communication. So helping with our brief summaries of research to make sure they're accessible to the public. And they'll be involved in other aspects of our communications policy. The second group that was set up was a governance subgroup. And as I say, members of the public are involved in governance at project and program level, but this group is about getting involved in strategic governance of the school. So we now have public partners who are contributing to the executive, to the SPHR executive group, which is the key decision-making group in the school. They're contributing to the advisory group. We've actually always had public members on the advisory group since the very beginning of the school, but now through the PAN, that opportunity is opened up to more members of the public to have that experience. And they will be participating in the strategy group and the operational group. So the opportunity for members of the public to get involved in decision making across the school, they're now opening up, and they're going to be making a very important, it's early days, but their contribution has already been really valuable and insightful comments. And then the third and final subgroup that's been set up by the PAN is most recently an evaluation subgroup. We're just entering, as I say, the last year of this second 5 years of the school. And so evaluating the process of involvement and the different models that we have and the impact is going to be a priority for this last year. And public partners on the PAN are going to be actively involved in that as peer researchers as well as advisors. So just a few other highlights of what we've been doing. So the operational group has been reviewing the diversity of public involvement across the school. As I say, we've got lots of different models and different approaches. And so they're looking for examples of good practice, but also for areas which are more challenging so that we can develop ways of supporting people. We've been setting up training opportunities for members of the public and for academics. And one highlight there was a collaborative training with the other 2 NIHR schools for primary care and for social care, where public partners in the 3 schools came together to share their experiences. And that was considered to be very successful, very valuable. We'll do more of that. We're also looking at producing a coherent policy on rewards and incentives for public partners. As I said, the school is 8 academic members, and that's more than 8 universities because some of those members are collaborations. So each of those universities in the school has its own policies and practices around public involvement, what fees they pay, how they pay them, what training they provide. So we have the risk of inconsistency across our members. So we're looking at all those policies and going to pull together a single policy for the school, for research that is funded and supported through the school. And that's going to be really important. And then a third area that we've got involved in with NIHR and other colleagues, other agencies, is to begin to think about a dedicated guidance for public involvement in public health research, population level research. There's a lot of guidance out there, we know there is, but we won't be duplicating that. We'll just be looking to see whether there are some gaps from the perspective of public health research. So that's just some highlights of what we've been doing. If you want to know more, you can download the strategy from the website. You can go to the website. You can get involved. Please do if you're interested, or if you want more information, get in touch. So thanks very much for listening to me. I'd like to take this opportunity to thank all the members of the public that are involved in the school, making an invaluable contribution to the work we do, and to the people who are contributing their time to the strategy group and the operational group. And of course, to everybody who's making public involvement work effectively across the school. Thanks very much.